Welcome everybody. It's Kim Pointer from MediCoach and Rivka Hagen from Medical Business Services. We're here today to talk to you about RACF COVEX services, what's available now in terms of incentives to go out and provide in-reach services for residential aged care facilities, and disability services is what we're going to cover off in today's session. But before we do, we'd like to acknowledge the traditional custodians on the virtual lands on which we all meet. So welcome from Biripi country, and I'd really like to
acknowledge country here.
I'd like to acknowledge the traditional custodians on land on which you meet and pay our respects to elders past, present and emerging.
So let's kick off this session. It's not going to take too long, but we really do want to bring you the news. And the reason why we're kind of talking a little bit fast too is because there is no time to waste. The new services availability is only here for a short amount of time. And so if you're going to tap into them, you really need to get your boots on quickly and start planning for these services. So what are we talking about here? We are talking about a dedicated allocation of Pfizer vaccines being made available to general practices to take out to residential aged care facilities as well as disability services as well, with the key aim of providing vaccination to the staff of those facilities. So it's important to remember that that's the primary goal of what we're trying to achieve here. Secondarily, we can certainly look at residents as well, and we'll talk you through the details there. So the dates in question that we were referring to just before is between the 29th of April 2021 to the 31st of October 2021. So obviously this is being recorded in August, and clearly April was a little way away. And we just want to make you aware that you can certainly look at any staff that you may have vaccinated prior to becoming aware of this new program, because they can be included in the counts towards that. Now, the additional services and the additional funding that's available is only for services that are delivered through on-site services, so outreach or in-reach, to the RACF facilities. And any aged care facility staff that you vaccinate within your own practice don't count towards the additional incentive. Now, the additional incentive that we're talking about here is a $1,000 payment for the provision of a minimum of 50 of these COVID vaccination services. Now, that funding is in addition to any of the stock standard funding that's already in place through Medicare. So these are the COVID vaccination assessment items that are already available now. So that depends on, the MMM location that you are in, whether you're administering or assessing the administration of a first or a second dose, and whether you're delivering this during normal office hours or whether it is after hours. So those item numbers, what you're using already, that maintains, that doesn't fall away. And just be aware too that the RACF flag fall items apply to these services as well, if you're providing this as a unique service, not in association with any other medical services that you might be providing at the RACF. So what we're talking about here too in terms of reporting and payment is that the COVID-19 vaccine administration system, which has only become available from the 12th of August 2021, to upload that information through that system, because that is the bit that's going to kick off the payment allocation through the practice incentives program. So there's a little bit of complexity around that, because of course you also need to upload this information through the AIR, the Australian Immunisation Register system as well. So there is a little bit of double reporting through that, but be aware and just be mindful that all of that gets covered off if you're going to participate in this. And as indicated just before, you can backdate it to the 29th of April 2021 if you've already provided similar services in the past. Kim, take it away.
So first step is you need to contact your PHN because they will be giving you the allocation of stock. So you can utilise your own stock if that's your preference, but the preference is from their perspective to let them know it's a requirement and they will provide you with additional doses of Pfizer. Again, it's a preference to have a pre-existing relationship. If you're a general practice that goes out and provides service to residential aged care facility, that's an existing relationship. And then you need to both go and approach the PHN and said that you're happy to have an in-reach clinic, what date that's going to occur. And of course, there's a bit of preparation involved in that, isn't there? There's discussion on when can you maximise the amount of staff that you can immunise, and is there any patients who need a second dose that you can administer at the same time? So how many doses do you need is obviously a very first port of call. Then you need to let them know, as in the primary health network, that you actually performed that clinic and confirmation that it actually occurred, and how many staff did you vaccinate as a consequence of your service delivery. And then we also need to make sure we're covering off clinical governance, right? So we need to make sure there's clinical eligibility. We're talking through the precautions and the contraindications, looking at vaccination history. So again, checking air and making sure that those staff haven't received their vaccinations elsewhere, making sure that flu jabs have had timely intervals as well, making sure we're documenting informed consent. Appropriate vaccination observation periods still exist, no matter whether we're within our normal general practice clinics or we're providing in-reach services. So we're going to require a few workforce to, assist us deliver this, aren't we? And we've also got to look at clinical escalation and reporting process for, of course, if any adverse events occur inadvertently.
Okay, so look, again, as we've highlighted just before, the recording of this vaccination information does need to go to the Australian Immunisation Register. And of course, it's kind of a given that you need to keep good clinical records for each vaccination that you provide, as you would do for under any other circumstance. We also need to just remember that the maintenance of the cold chain integrity is really important, both during transportation and the services delivered on site. And that, I guess, just adds in another layer of complexity there. And it will depend a little bit on whether PHNs arrange for vaccine stock to get delivered straight to the RACF, or whether that comes through your practice facility first. So you do need to think about your own storage capability and really the workflow processes that stem from that. And so there does also need to be an assessment of the adequacy of the infrastructure at the RACF to really support running this clinic. And so you may find that depending on the space that's available, you may not be able to do 50 in one go or even in two goes. So you may need to plan more frequent attendances, but with less less staff being vaccinated. So again, there's just a lot of variability about what's going to work for your circumstance, your location, your RACF. So a lot of thinking processes need to go into that pre-planning. So also just to remind you that the idea is certainly not to waste any stock. And although we are predominantly talking about the immunisation of workers within the RACF and disability workplaces, it is absolutely permissible for vaccine stock to also be used for residents to receive their second dose, so not their first dose. That's absolutely okay, but just be mindful that you can't count those towards the 50 that make up the additional payment that you're going to be eligible for. And any sort of opportunistic vaccination absolutely should happen in preference to discarding of stock. So there's going to be a bit of communication that needs to take place with the RACFs, isn't it, Kim? Just in terms of what are we going to do and how are we going to plan that? What would be your first step in this process?
Well, we're really trying to make sure that we're having a workforce that's all vaccinated by the 17th of September. That's when mandatory vaccination is going to be a requirement in disability and aged care facilities. So I think that, you know, first and foremost, I'd be approaching them and saying, look, we really want to make sure that you're having your workforce available and there's that continuity care for your residents. So what days of the week are going to be most suitable for us to come in? What time of day is going to be less disruptive for both parties? And how can we make sure that we can get maximum amount of, you know, people on site at the one time? So again, you know, looking at those sort of logistical things to make sure that we can get as many of those staff members done, you know, by that deadline date of the 17th of the 9th is utmost. But making sure that, you know, you're having lots of two-way conversations on how can we make sure that we're being less disruptive to both organisations.
Yeah, exactly. And, you know, certainly from the PHN perspective, they're going to be preferencing any pre-existing relationships between practices and RACFs as well. So I guess for practices that don't have a current relationship with RACFs, in that space, you may actually want to touch base with your PHN first and foremost, because you don't want to be doing all that work and then finding that the PHN is not going to support you with additional stock because of a lack of a pre-existing relationship there. So that's an important one to cover off as well. Okay, so more information. Where do we get some additional details from? There is a URL there, which is to the official Australian government document that really underpins the information that we've provided for you here. So feel free to download that and have a closer look at that as well. Any other information, Kim, that we need to cover off?
No, I think we've covered off everything that we do need to update everyone in terms of COVAX delivery at this stage of the game. And if there is any more further information that comes out, we will be providing little snippets like this just to keep you up to date, because we know it's a lot of information to keep abreast of.
Absolutely. And another hearty congratulations to all the practices out there just working so hard in this coronavirus space, in the epidemic, and doing all that you can to keep everybody safe. It's a tremendous effort, and certainly we salute you all.
Thank you.